Hi, everyone. Welcome to a conversation that we're having today with some of the leadership with the Colorado Department of Public Health and the Environment. I'm really excited that they're joining me today and CoPIRG to talk about their agency. It's a big one. They do a lot in the state of Colorado, and I think it'll be interesting to learn a little bit more about what they do. Everything from waste and diversion to air pollution and water pollution to smoking cessation and disease prevention. It's broad. And so I'm excited to dive in. We're mostly going to be talking about things that CoPIRG works on and the overlap that we have. But I just want to thank both of you for joining us. So we have the director of the Colorado Department of Public Health and the Environment, also known as CDPHE. So Director Ryan, thank you very much for joining us today.
Thank you, Danny.
And then we also have the director specifically of the environmental program. So Tricia, thank you very much for joining us as well.
Thank you, Danny. It's great to be here.
So I guess, Director Ryan, I'll just start with you. How do you think about the mission? So if somebody's like, oh, what do you do for a living? And you have to describe CDPHE, kind of how do you describe that?
Sure. Well, you're right. The breadth of CDPHE and the public health field in general is vast. Our mission is really advancing Colorado's health and protecting the places where we live, learn, work, and play. And in public health, we consider the population to be our patient, and we regularly perform community health assessments to determine the health status of our patient. You can think about public health. It really touches people's lives everywhere and every day. We work behind the scenes on those things to keep you healthy outside of a doctor's visit. So we've got a lot of programs such as enforcing clean water and air pollution. We conduct restaurant inspections, implement disease control and injury prevention programs, preventing chronic disease, reducing greenhouse gas emissions that cause climate change. The list really goes on, and governmental public health exists at the county level. All counties are covered by a local public health agency, of course, the state level, and then the federal level, and we all partner together and act like one system.
That's great. That's great. And like I said, I mean, there's so many different things. We'll talk about some of them today, but there's so much more. And so in our blog that goes with this podcast, we'll put the website for CDPHE so people can look and explore some of the ways that they can interact with their agency. I know you from many years ago when you were up in Vail and you were in Eagle County. Can you tell me a little bit more about what motivated you to take on this leadership role? Where did you, how did you come to CDPHE?
Sure. Well, so I've been in the public health field for nearly 30 years. I've been a local public health director, as you mentioned, up in Eagle County. I've also been on the State Board of Health for many years. And I'm actually in my 15th year at CDPHE. So I had worked for the department off and on for 10 years before Governor Polis tapped me to be the executive director back in 2019.
That's great. And so then, Tricia, you have a broad perspective as well, because you have a bunch of different environmental programs under your oversight. What motivated you to take on this leadership, and kind of why is this an important job for you?
Yeah, thanks, Danny. So I moved to Colorado over 20 years ago, and like many of us who have done that and made that move, it was really, motivated primarily by a love of the outdoors and the beauty of our natural environment here in Colorado. And so for me, after I got my law degree here and started practicing law, it was very much a passion of mine to work in the area of, environmental protection and public health protection. And, I moved into public service about 15 years ago, and just really connected to the mission of, the mission of the work. And being at CDPHE for about 10 years now, I've just been so impressed by the caliber of the talent that we have at our workforce in CDPHE, and really that commitment and shared passion for our mission and our values. And so, leading folks who have that level of commitment to it has just been really humbling and inspiring.
Yeah, I mean, it definitely takes a village, as they say, and there's a lot of things you all are responsible for, and so yeah, that's going to require some really good people, and we're really glad that you all are out there building a team that can be looking out for our environment and for our health. CoPIRG interacts with CDPHE in a number of ways. So we like to say, we speak out for a healthier and safer Colorado, where everyone's freer to pursue their own individual well-being as well as the common good. And so there's a lot of different places where we interact. I thought we could start with waste and recycling and diversion. This is a really important one. We do an annual report on recycling. We have found that Colorado still too much of the stuff that could be recycled is getting into landfills, and we've seen some massive steps in the right direction over the last decade, really, in Colorado on a municipal level, but then also on a state level. And it seems like consistently the thing that's really missing from a waste diversion perspective is just making it easy for people to do the thing they want to do, which is get the recycled material into a container that then gets collected and sorted. But we oftentimes are missing that infrastructure, especially outside of the Denver metro area, but really across everywhere in the state, we're missing that infrastructure. And so one thing I know you all have is a grant program. And I'm wondering if you could talk a little bit more about this grant program that you have that can help build out some of that infrastructure, if you have any success stories or anything about that.
Yeah, I would love to. Yeah, I mean, before I get into the grant programs, just to highlight, just the importance of recycling, as you noted, right? I mean, when we recycle, we reduce the amount of waste that's sent to landfills and incinerators, right? So that means that it's important because we reduce our carbon footprint, we conserve natural resources, we save energy, we prevent pollution, just, all of the things. It's a really important part of our work. And so the grant opportunities that we have available, I'd highlight two of those. So one is that we have this new program to provide Front Range communities with free technical assistance. So any community that's located in the Colorado's Front Range is eligible to receive support through our technical assistance service provider. They're led by Resource Recycling Systems and EcoCycle. And we have an application that's live right now, and so folks can apply through that program to get that technical assistance. It can be done, community could do that independently, or they can kind of join together as multiple towns, cities, or counties and work on a joint project. So that's a really great opportunity. And then we also have our next round of the Front Range Waste Diversion Grant funding available. And so this round, we're going to be focusing on waste diversion through a couple of particular areas. And so that's construction and demolition waste diversion and reduction, organics, so diversion and reduction of organics, and then really recycling infrastructure and collection projects. So those are, that round of funding has also been launched. And we've had a lot of success. So since 2020, our Front Range Waste Diversion Program has supported 38 projects, helping to move the needle on that waste diversion rate that you mentioned. We really want to increase. And we've funded a variety of projects across the Front Range, and it's resulted in additional diversion of nearly 30,000 tons of material each year. So we are moving the needle. And I'd love to just share one particular story of a project that we were able to fund. So this is the food rescue project, and the grantee is We Don't Waste. And it's a really exciting project where we awarded, they're actually a two-time grantee, receiving about $200,000 and $150,000 in each of those efforts. And they're doing things like expanding food rescue and distribution along the Front Range. So We Don't Waste is using grant funds to increase food rescue and organics diversion efficiency. They purchased like a walk-in freezer and food transportation van. So it's really getting, both at like getting that organic material out of our landfills, but also into a place where, people who are food insecure have more access to food. And so we're really proud of that project.
Mm-hmm.
So if I'm a local government, if I'm a business, if I'm a nonprofit, and I have a good idea, I should be checking out these grants and seeing if there's some overlap. Is there any limitations? Like, can a business apply? Can a nonprofit apply? Can a local government apply?
Yeah, for the technical assistance program, it's for Colorado Front Range communities, and then for the Front Range waste diversion, really that is available for all kinds of different communities, and so we really would definitely welcome people to look into these.
Great. All right. Well, we'll put a link to that in our blog post that, if you're following along, check out our blog and you can find some resources to all of this. The other piece of waste, which I'm really excited about, is the Colorado legislature passed this law that at the time we were the third state in the country to act to set up what is known as a producer responsibility system, but I don't think any of us really knows what that means. But essentially, the way I think about it is right now, we, the customers, local governments, the state, are oftentimes left with all of these different items, boxes, bags, jars, lids, whatever. And we have to kind of figure out what to do with them. We have to figure out how to collect them. We have to figure out how to sort them. We have to figure out if there's value in the marketplace for them to be turned into something else. And so the producer responsibility system, I'm really excited because it kind of flips it so that a lot of the companies that are producing products will just have a little bit more, will have to be part of the solution a bit more, in the sense that they're going to have to fund more of the collection and systems. So I think more people, our vision is hopefully everybody will have access to curbside recycling in the future once the system's in place. So they're going to help fund the build out of the system. And then if all of a sudden we have way more stuff getting into those recycling bins, then these companies now have way more materials they can reuse. And so that should be a really good benefit, and should also drive some design changes so that they're producing things that are more recyclable, since they can now get those things back to reuse them. So it feels like a really exciting opportunity. It's going to take a number of years, as I understand it, but I think one big step happened. I heard recently we have sort of designated an official producer responsibility sort of organization to kind of start the process. Can you kind of tell us what's happened and kind of what you expect over the next year, maybe?
Yeah, that's exactly right. And we're really excited about this as well. So we have appointed Circular Action Alliance as the producer responsibility organization. So they will be in charge of kind of putting together this program for new statewide recycling. And so what they're going to be doing is developing that convenient, cost-effective program, right, that will ultimately provide the free and equitable recycling of both packaging and paper, all of the things for Coloradans. And so by the end of January of next year, so 2024, they will have completed a statewide needs assessment, right? So they'll be looking at evaluating what kind of recycling infrastructure do we have throughout geographic areas of the state, and where are our needs and gaps. And then after that, they will develop a program plan to detail how to implement the program, right? And then they'll be establishing targets for minimum recycling rates in Colorado. So first by 2030 and then by 2035, so that, we have very clear, measurable targets, and we're working very directly and ambitiously towards them.
That's great. And there's even an advisory council that I know some of the folks that I work with on the local government side and the nonprofit side are participating in this advisory council to help advise it. So that's exciting. I'm glad we have that sort of check, that system in there as well. Well, let's talk a little bit about water. So we do a lot of work. Unfortunately, our country built a lot of pipes and a lot of water infrastructure that had lead. And so we're stuck with a system right now where we're trying to figure out how to protect people, especially kids, especially in schools, from lead getting into water that's going to, they're going to drink or is going to be used in cooking or whatnot. And so I know there's a big date coming up that you all are responsible for, June 1st. There's a tracking moment, but I guess could you talk a little bit about why it's important we get, protect kids from lead to begin with, and then maybe how this tracking moment that's coming up where schools are going to test and ideally identify places we need to fix fountains and whatnot.
Yeah, absolutely. So lead is associated with negative health effects, and that's especially for young kids, right? So lead builds up in the body over time. So that kind of ongoing exposure, even if it's at low levels, kind of over time can eventually cause health effects. And so we've seen that exposure to lead can result in kids' physical or mental development, and lower birth weight for babies, kidney problems, things like that. And so it is something that we certainly take very seriously. Exposure to lead can come from a number of different sources, right? But old and corroded lead plumbing or old brass fixtures can be one of those things that contribute to those elevated levels in drinking water in particular. So yeah, we have this program. It's Test and Fix Water for Kids program. And in it, so all licensed childcare facilities and then public and charter schools serving preschool through 5th grade have to test for lead in the drinking water within their facilities and then remediate locations where they're finding elevated levels. So as you mentioned, so there's, it's through the end of this month when all that testing needs to occur, but we've had really great enrollment. So we have over 35. Yeah, absolutely. 3,500 facilities across the state have enrolled. We have taken more than 25,000 samples. And so, we do have those sample results posted on our website. Happy to share that link with your listeners. And we're also really excited, we'll continue to offer that sampling and remediation at no cost for the facilities that are currently enrolled. And then we do plan to expand it to middle schools as the next phase of the program.
That's great. And obviously a big part of this is money. So if you find there's elevated levels of lead, or, we're advising, if you can, to just replace as many things as many drinking fountains, faucets as you can with these filters. As I understand, there is some money available. Is there still money available if you're a school district looking to do this remediation? Is there a way to pull some money down from CDPHE?
Yeah, yes, there is. We're really excited to be able to work with schools to help with the remediation assistance and reimbursement of those costs to address lead levels when they're found to be elevated.
Keeping a little bit with kids and kids' health, I know here in Colorado we have we oftentimes rank high for teen vaping. And I know smoking cessation is another area you all work in. And I think people would be interested to know, like, what do you do in that space? And how are you involved in helping to kind of reduce this teen vaping and teen smoking epidemic?
Yeah, Danny, thank you so much for the opportunity to talk about this. We had started to see a decline in smoking really in the 90s, through the early 2000s, that just, I think, really shined a light on the effects of public health programs and smoking cessation. And then vaping came about and became, popular, especially among youth. And the thing about vaping is it delivers such a high level of nicotine, higher than cigarettes do, and it can lead to a lifetime of nicotine addiction for these kids, more likely to be a gateway for them to start smoking. It interferes with brain development, and also there's other harmful chemicals in these products. So we do, as I mentioned, we do a lot of health surveillance, and one of the things we implement is a Healthy Kids Colorado survey. And I'm happy to say that it has showed a significant decrease in the percentage of young people who report vaping compared to previous years. Now about 1 in 6 Colorado high schoolers still say that they vape. Now, for young people between the ages of 12 and 17, the state offers free confidential support to help them quit using tobacco and nicotine products. It's through a program called My Life, My Quit, and services are available 24/7. Youth can sign themselves up by texting START, START, to 36072, or by visiting mylifemyquit.org.
Right.
And this service is great. It helps young people work with trained coaches via text or line or over the phone that can help them understand nicotine addiction, make a quit plan. We also have a quit line for adults, which also offers some nicotine replacement patches. And people can look that up through just Googling the quit line. But we really are here to support people to either stop smoking or vaping, and it's one of the single best things that you can do for your health.
Absolutely. It's hard when you talk public health not to think of COVID, and you all played a central role in the last few years as we have all been grappling with this. Could you talk a little bit about the role your agency played, and how you were involved in protecting people in Colorado over the last couple of years?
Yes. So disease control is a core public health function. It's one of those things that goes on behind the scenes that people don't even know about. We have a really robust disease reporting system across the United States. And that means by law, certain diseases are reportable to local and state public health departments. And in this manner, we can tell if there's an outbreak, if there are elevated levels of disease. And we certainly used this function during the COVID-19 pandemic. It was able to provide many indicators a day, like the number of cases, how quickly cases were increasing, where the cases were around the state, the percent positivity of tests. We also track things like hospitalizations, deaths, number of hospital beds available. And so we were able to provide this information to the governor for policy decision making around the pandemic. The other thing, operationally, we run a state lab, and we really souped up that lab to run 24/7 during the pandemic and provide testing at levels just unheard of for a state lab. And we were able to be one more resource when some of the private labs were overwhelmed. And a lot of times we would test vulnerable settings. So we could rush tests in long-term care facilities, for example, or correctional institutions. Between our state lab and our testing partners, we administered 21 million tests.
Wow.
And we facilitated 12.6 million shots in arms through mass vaccination clinics and mobile buses. So we had a very, very significant role, and in the beginning, it was such a massive event that the healthcare system had a hard time, catching up and implementing testing and vaccination. So for a while, it was really public health that were running these mass clinics across the state to get people the services they needed.
Yeah, absolutely. I know for a lot of us, it feels like we're close to back to normal, however you want to define that. But I feel like it's still worth making sure people know COVID's still out there. It's still highly contagious. There are still some precautions and safety concerns that people should have. What tips would you have for folks if they were saying, "Oh, should I just act like it's no longer there?" What tips would you have?
Well, first of all, I would say that vaccines have just been a game changer. And, there's an Omicron booster. It's specific to this variant. And so I would highly recommend, for the highest level of protection, that people get their full series of vaccinations. Of course, the usual, disease control measures: always wash your hands, stay home from work when you're sick. COVID tests are very prevalent now in the grocery stores. So if you start to get symptoms, which can look like a lot of things, right? Respiratory, fever, sore throat, people should test to determine if they have it, and then of course seek healthcare and stay at home. But the good news is that Omicron is very contagious, but much less virulent. That is, it causes much less severe disease now, and it makes this a disease that we can live with a little bit better, because prior to Omicron, we were always worried about hospital capacity and our hospitals filling up. Yesterday was the end of the emergency. We spent 1,169 days in a state emergency response mode. And at this point, really pushing this back into the healthcare system, and people, going to their providers, their usual source of care. for anything COVID related. But rest assured, public health is still there. We're still conducting disease surveillance. Should there be another surge, a new variant, we will go back into response mode.
Great. Any lessons learned in terms of preparing us better to reduce the risk of the next disease like this?
I will tell you, COVID-19 was so novel. Like, we have never seen anything like this in our lifetime. The fact that it was so contagious, caused such severe disease, and had such a large asymptomatic nature, right? Some people didn't get sick from it, didn't know they had it. It's not like the flu where it knocks you out and you're just in bed for days. And so I feel like we have been through the worst of it, and both the public health system, the medical care system, and just citizens at large, we just know better. And I feel like if something like this would come around again, we've got a lot of tools, right? Wearing our masks and working from home, and developing vaccines, fairly quickly. There's a lot of new technology that we didn't have before. So we will be just really well prepared for the next either change in this disease or frankly, a new pandemic.
Yeah, that's great. Switching gears again, there's a lot of concerns around toxics out there. And I know one that started to really kind of rise to a higher level for folks are referred to as PFAS. We call them forever chemicals, because oftentimes when they get into our environment, they're going to stay there for a very, very long time. They are found in a lot of things that are water resistant or stain resistant, or heat resistant. And so I know recently the EPA has been taking some action or making some recommendations around what we should be doing around PFAS. And so would love to just hear a little bit about what's the state doing, given we've had some bad examples of places where PFAS have really polluted waterways, like down in Colorado Springs.
Yeah, that's right. So you're right. We've been working on this issue since 2016 when we discovered some high levels in that area, and because of that, I would say here in Colorado we're really ahead of the curve when it comes to mitigating PFAS contamination. Since then, we've been working with our water systems to test, where do we have high levels, but then really partnering with our water providers on providing resources and expertise to treat for PFAS as well. So we have absolutely been following and tracking, EPA's actions, both with respect to the updated health advisories and now some draft drinking water regulations. So we expect that EPA will finalize those probably in the next year or later this year, and then Colorado will work to adopt those rules and work with our drinking water systems to implement them through sampling and all of the regular avenues. But in the meantime, we developed a PFAS action plan and have done a lot of things through that. So we've helped over 400 communities and also private well owners. So, about 70 private well owners or so sample for PFAS. And then we've taken all of the data that we have about, where there are elevated levels of PFAS and created an interactive map that displays those sampling results. So if people want to understand, where have more awareness about where is there PFAS contamination in Colorado, they're able to get that information. We've provided a lot of funding assistance, over $3 million, to help communities treat for PFAS in their water, which, it's a really big challenge, and we know it's going to take a lot more than that. But, we have a lot of work in that area as well. We're also looking at ways to get sources out of the chain, right? So we've taken back about 15,000 gallons of PFAS-containing firefighting foam from about 40 fire departments. So, that way we're preventing it from contaminating water supplies in the future.
That's great. With just the last few minutes we have here, I wanted to talk about ozone and air quality issues. This is probably one we could do just a whole segment on in and of itself. So we'll keep it relatively high level and just, we're heading into what is traditionally an ozone alert season. The EPA, has designated our area as not meeting the health standards for reducing pollution. And for us, there's no one solution. There's just no one thing we can do that's going to reduce our ozone pollution. I am curious, though, a lot has happened. And so what's one thing you can point to as we head into ozone season to just know, like, here's an action that's been taken. Here's something that's going to reduce ozone pollution as we move forward.
Danny, I'll start, and Trisha's going to get a little more into ozone, but I just wanted to take a second to really brag about some of the recent efforts in air quality. The Air Pollution Control Division in our department is a division that had really been under-resourced for decades. And, the environment is Colorado's brand. It's what attracts us here. We've been really intentional in working with the governor, the state legislature, to secure significant investments into this division. In fact, over the last couple of years, we've received $50 million to really update our technology, increase our staffing by nearly 100 people. We have brand new technology in the area of air monitoring. And there's been a lot of really significant legislation around reducing greenhouse gas emissions and air toxics and environmental justice. So it feels like a completely brand new day at the department around the issue of air quality. You mentioned ozone, which has really important health implications. And I'll have Trisha talk to you more about our state implementation plan and activities to reduce ozone.
Yeah, thanks, Jill. To build on that, I would just note we've been working fast and furiously on our state implementation plan. We have another slew of rules that we're looking at proposing this year. Adopted a number of measures over the past couple of years that include all kinds of things. A couple of things to highlight would really be, around our mobile sources. So that's cars and trucks. And so our Air Quality Control Commission recently adopted our proposal to increase the availability of electric trucks.
Yeah.
That's really significant and
Yeah.
really exciting. And kind of in tandem with that is, we're also looking at building on rules on zero emission passenger cars available in Colorado, right? Making more electric vehicles available for sale here in Colorado. And so that's another thing. And on top of regulations, we also have a number of grant programs. So really exciting grant programs to fund zero emission school buses and cleaner fleet vehicles and things like that. So really just trying to address the problem from all fronts and with a lot of creativity and innovation.
That's great. And I know that the governor recently has also made a bold, it'd be nation leading, goal of reducing nitrogen oxide emissions from oil and gas sector. We are running out of time, but just very briefly, any sort of next steps on that in order to hit that goal, and what can we expect in terms of the sort of next step there?
Yeah, absolutely. So we're working really closely with the Colorado Oil and Gas Conservation Commission on that goal. We're meeting weekly with them, and are working with stakeholders as well for the development of rules, right? So we anticipate that both of our commissions will be taking action this year to put things into place to meet those goals. And in a number of ways, we may see electrification of engines as a component of it and other things. And so we're really developing what those control measures look like right now.
That's great. So I really appreciate you taking this time. Obviously, we could have spent so much more time on all these issues, but I hope that people who are watching and listening just come away with a better sense of just all the things you all work on. We will obviously link to a number of the things we talked about here, the grant programs, the databases, the information. I guess any final words you'd like to say before we wrap, Director Ryan?
Well, Danny, I really want to thank you for your time today, just to showcase CDPHE in the public health field. And I want to thank you and CoPIRG for just everything you do, to make our world better. There's a lot of intersection with public health. So I know we've got a lot of shared passions in this area.
Great. Well, thank you very much for joining us. And like I said, check out our blog, which should be right next to